Hello and welcome to the third edition of the Economic Times Consumer Freedom Conclave. The theme for this edition is reframing societal views on harm reduction, a medical and scientific perspective. Today's virtual conclave will feature interactions with thought leaders from across the globe on issues pertaining to consumer freedom and their choices, including but not limited to freedom of choice, a democratic approach to lawmaking, prohibitions, offering safer alternatives as a choice, an innovation-driven economy, and much more. I'm joined by subject matter experts to help me do just that. It is an honor and privilege to welcome Clive Bates, Director, The Counterfactual United Kingdom, for the opening keynote titled Tobacco Harm Reduction, How Consumers Could Secure the Greatest Public Health Win of the 21st Century and How Regulators Could Stop Them.
First of all, the harm primarily caused by smoking. There's a huge burden of health impacts caused to the heart, to cancer, to the respiratory system, multiple conditions caused by this. Smoking kills prematurely around 8 million people annually, more than obesity accidents, road accidents, alcohol, drug misuse, and HIV combined. India has the second largest number of smokers in the world. Now, the central insight in tobacco harm reduction is that people smoke for the nicotine but die from the tar. Okay, it's not the nicotine, that's the reason people are smoking, but it's the toxic gases and thick, sticky particles coming from the burning tip of the cigarette that cause the harm when that smoke is inhaled into the lungs. And now we have a range of nicotine products that don't produce smoke. So we have vaping products, we have heated tobacco products, we have so-called oral tobacco products like pouches, and then we have smokeless tobacco products, been around for a long time. Policy making has not helped. One of the most vocal groups, the union, the International Union Against Tuberculosis and Lung Disease, believes that all of these products should be prohibited in low and medium income countries, in which it would include countries like India. Now, this is ridiculous. They would have smoking products on the market, but the much safer products are the ones that they would ban. So what happens when you ban a product like that? The kind of assumption is the intended outcome is that people will be abstinent from nicotine, vaping, smoking, but that's not what happens in reality. Here, and we're not going to go through these, are a long list of possible responses to a ban on something. A black market that will relapse to smoking. They will use workarounds. They will use flavoring agents from food, drink, or aromatherapy. Nothing is as simple. A ban doesn't cause something to disappear. It causes it to be supplied in a different way by different people at a different price. I'm going to leave it there. I thank you very much.
It's an absolute honor and privilege for me to welcome Professor Dr. Rohan Sequeira, consultant cardiometabolic physician, specialist in non-invasive cardiology, diabetes, endocrinology, and obesity management, honorary consultant physician to the Governor of Maharashtra, senior consultant physician at Jaslok Hospital, St. Elizabeth Hospital, SL Raheja Hospital, and Holy Family Hospital. He's a leading practitioner from India and across the globe, and Professor Dr. Rohan Sequeira will provide an in-depth update on the latest R&D and evidence for harm reduction.
I'm going to speak about what exactly is harm reduction. It's actually a strategy. There is a very, very clear-cut guidelines and principles for harm reduction, and it's directed towards individuals or groups. The objective of this strategy is to reduce harms associated with certain behaviors. Now, there are different kinds of behaviors that we have, different kinds of addictions that we have, and how do you reduce the harm for that? To get a brief understanding of the areas in our society today which actually need a very strong addressal with regards to harm reduction. Number one in the world today is alcohol. Number two is smoking. Surprisingly, but not unforgotten is high sugar. I mean, you have so many people who are addicted to sugars and high sugar products. Then you have drugs and you have tobacco products, which are non-smokable tobacco products, like you have the pan, you have the gutka, you have the different kinds of chewable tobacco. Just science by itself cannot reduce harm. It has to be combined with a behavioral pattern, and this is where a lot of work needs to be done. So science and behavioral patterns are integrated into each other to form a good harm-reduced alternative. So the 4 pillars of harm reduction and science and behavioral patterns is, number 1, maintaining health and dignity. You have to maintain both, but with positive outcomes. Second is maintain participant autonomy. Then you have a participant-centered services. And at the end of the day, we have to be real. We have to have pragmatism. We have to have realism. We know that, we believe in the Murphy's Law. If something has to go wrong, it will. So there's a very, very high chance of people who are in that pattern or in that addiction kind of a mode, that if they're not supported by society, if they're not supported by their loved one, they're going to slide back into that particular pattern of harm, of harming themselves. I want to thank you for this short presentation. It was a pleasure to address this, sir. Over to you, Mr. Ivy.
With that, we move on to the panel discussion titled Clearing the Smoke, Assessing the Science Base for Harm Reduction and Creating a Framework for Incorporating Science into Policy Making. And it's an absolute honor and privilege first to welcome the members of this power-packed panel. First up is Professor Dr. Sharifa Izzat Wanpute, Chairman of Malaysian Society of Harm Reduction, Professor in Public Health, Faculty of Medicine, National University of Malaysia. Dr. Kiran Melkote, orthopedic surgeon based in Delhi, India, and member of the Association for Harm Reduction, Education and Research. Dr. Lorenzo Mata Jr., President, Quit for Good, and Supratim Chakraborty, partner, Khethan and Company, corporate commercial tech data protection. This session will be moderated by Pooja Jain, anchor at Times Network. Pooja, over to you.
Professor Pooja, I'd love to kick off the conversation with you. And for sake of some context setting, harm reduction, to my understanding, broadly refers to the policies, the programs, and the best practices that help minimize the negative societal impact of substance abuse. But for the benefit of our viewers, help us better understand the term by breaking it down in layman language, please.
The issue of harm reduction, this is not an easy task because it depends on basically your government, your governance, and how's the models uptake by each country. Example, for certain countries, UK has one of the best policy that I see, besides maybe Australia and New Zealand and Japan, where they actually promote or basically condone the area of harm reduction and reduce risk products, things like IQOS, like ends, and also vapors. But in certain countries, this is very much a taboo. So they don't really acknowledge harm reduction. And I think the most benefit will be for the smokers if there's some sort of regulations or some sort of guidelines which is approved by the government. Of course, this doesn't come easy. They have to look at other models and other societies, how they progress in harm reduction. Because in some of the ways that I look at it, example in Europe and UK, the regulations are quite strict. Example on vape and ends, by MEHRA, FDA and things like that. So I think this is one of the best methods where you actually curtail the quality, but also monitor how it's going to be implemented for the society.
Supratim, my question to you is around these safe alternative products that we keep on discussing. And the general observation is that to some extent, they're simply plagued by inadequate or ineffective policies. So in the larger picture, is there simply a lack of political will to blame here when it comes to mass adoption of harm reduction principles?
When these alternate products start becoming popular without getting regulated, I think it is then that our regulators start looking at it, right? And they think of regulating it. And of course, there is always this aspersion cast that perhaps the larger industries which are there in the primary product which is causing harm probably are lobbying hard to see that there is an embargo on the newer alternatives, okay? Sure. And that is the reason that we see such harsh embargoes and regulations and alternatives. So that is one piece of this puzzle. The second piece of the puzzle is what are the elements that the the government has to keep in mind when they're framing policies, okay? And I think there are kind of threefold points that we should keep in mind. One is economic regulation, okay, which is important from an overall economic development perspective. The second one is societal regulation, which is like health, safety, etc. That plays a large role, okay? And the third one is the administrative regulation. Now, what we're observing here slowly is that society, the social regulation is playing a larger role at times and trying to see that they overshadow the other two from an importance perspective. The way to approach, to my mind, is a balanced approach. It's a middle of the road approach, not going either way.
Dr. Kiran Malkote, I'd love to come to you and get your view on the cessation only approach. But beyond that, I'd love your take on when it comes to replacement therapy. What are some of the risk reduction strategies that have proven to be particularly effective, sir?
So I think the main problem here is the WHO and most of our governments has chosen a single way, that is cessation only approach. That may not help everybody. It is a great goal to completely quit nicotine. But if you look at the targets that they have set, if you look at the numbers of people that they're helping, it does not help everybody. So one approach for everybody is not a good idea. So if you look at the different harm reduction techniques, or if you look at the strategies, the basic concept is very simple. Nicotine by itself is far less harmful than tobacco. If you actually look at tobacco as a whole, and if you actually look at it separate from nicotine, then it makes a lot of difference. Now, most of the users smoke because of nicotine. So if you can de-link the two, if you can give them their nicotine without the dangers of tobacco, that would definitely be harm reduction. Here in the Southeast Asia region, we have a much higher problem with smokeless tobacco also. So I think if you look at the harm reduction strategies, vaping or ends is just one part of it. There is always going to be a cessation approach as well. We cannot discount that completely. But apart from that, there are many other ways that we can help the smokeless tobacco users, like for example, snus or nicotine pouches. We can also start them on lozenges nowadays. So I think there are many different strategies available, but until we accept that harm reduction is a viable strategy for tobacco control, I don't think we can move further from there.
Well, Dr. Mata, I want to come to you now. And my question is, do you believe that there is adequate application of harm reduction principles in clinical practice today? Where do things stand?
Yeah, thank you, Roja, for that question. Actually, for me, it's a no-brainer, really. The whole idea of harm reduction just sort of comes naturally in the practice of medicine. COVID, for example, is one perfect application of harm reduction principle. We do not, as of yet, have a conclusive encompassing knowledge and understanding of the disease, as everything is still a work in progress. Now, in the context of tobacco harm reduction, there's a strong need to educate both adult smokers and medical experts on the science behind the less harmful nature of smoke-free alternatives to combustible tobacco, such as vapor products and heated tobacco products. Clinical application of tobacco harm reduction as far as vapor products and heated tobacco products are concerned should be augmented to fast-track the decline in smoking prevalence. When I'm approached by a recalcitrant cigarette smoker, I always tell them to quit smoking altogether. That's the best route to eliminate the harms of combustible cigarettes.
I'd really like to thank all of our panelists for sharing such a rich range of perspectives, from their personal and professional journeys. You've really all added a unique dimension to this complex conversation.
Welcome back. And now to shed light on whether Indian consumer laws should evolve to allow more choice for consumers, it's an honor and privilege to welcome and introduce Dr. K. Madan Gopal, Senior Consultant Health, Niti Aayog, National Institute for Transforming India.
Health services in the country, there is a notion that 70% of the expenses happens in the private sector. The government is also doing its own bit If you look at the systems elsewhere, like the NHS system in UK, where it is patient-centric approach is there, and the patient is, if you are thinking about me, you should be thinking about me, not without me. That kind of approach is there. And we have also tried to see that how that approach is built into our system. Though we have regulations, we can at least ensure safety for the patients. But are these regulations adequate? Can this regulation ensure adequate quality of services provided by the institutions or the practitioners, or can I get a good quality medicine? These are the questions which needs to be answered. We need to put efforts for increasing the capacities as well, capacity for enforcement of this regulation. That's one aspect. The other aspect is how far the consumers, that is patients, they are involved in management of the healthcare, so that the centric approach is there and the harm reduction, the harm which can happen to for a particular way of method or SOPs which have been practiced by a particular institution, that can be reduced. We have also made some efforts in bringing the patients into our decision-making process. In the public sector, you have seen that the communitization of health element was introduced in the National Health Mission, wherein the representative of the people, they are a part and parcel of the management committees of the health institutions. This is the involvement of the people, so that they know that what is being offered and how they can contribute to the betterment of the services. If the people participate and try to contribute to the decision-making process, the results are quite obvious, and things will happen. I will stop here. Thank you very much for this opportunity.
We've collected a panel of experts to discuss the issues around consumer freedom and choice.
Sri, as we begin the new year, what are your expectations from your governments to encourage an evidence-based approach to policymaking?
When we begin this new year, we are definitely looking towards a most positive environment towards evidence-based medicine, because the pandemic is emerging on a daily basis. New guidelines, new frameworks are emerging for managing the pandemic. Similarly, towards the policies related to tobacco in our country, we would also like the government of India to adopt the same approach of science-based and evidence-backed policies. And we are hopeful that the government of India would adopt a similar approach, unlike the previous policies, which are stagnant at the tobacco control stage. We strongly believe that tobacco harm reduction could be the most practical approach.
I want to very quickly bring in David here to give us the global perspective. Various countries have taken different approaches to tobacco cessation. How can countries like India learn from these progressive policies?
It's really quite simple. It spreads when you have informed government officials looking at what can they do to improve things within their own country. What is the evidence from overseas? We also have the importance of consumers themselves speaking out to say, what about us? Why aren't you paying attention to our rights, our opportunities? Let us be part of the solution. That's what works for public health. And we need to do that. We need to empower consumers, but we need to listen to them, to meet them where they are, to understand their lived experience, and to come up with policies that allow them to improve their own health.
Right. Thank you so much, David and Sri.
If I could begin with you, Michael, harm reduction refers to the policies, the programs, and the practices that aim to minimize negative societal impacts associated with addictions. Could you please elaborate a bit more on what this means?
Harm reduction in general means to put practical solutions and methods which work in real life first. So in our case, when we talk about smoking, the best and optimal outcome would be if all smokers would just quit smoking. But we don't live in a dream world, so for most people that is just not possible to quit without any help. And then harm reduction comes into play, and we need to have solutions that work. From a general public health perspective, it's way better to get people off the proven and very deadly substance to a way less harmful substance. And I think that is harm reduction, should be the harm reduction strategy for every country.
Samrat, Do you think safer alternatives are generally plagued by inadequate or ineffective policies? And what role can positive regulations play in enabling consumers to benefit from these safer alternatives?
So as a simple rule, products which are less harmful should have priority over more harmful ones. But strangely, this is not what is happening with nicotine products currently. As the most harmful products such as bidi, keni, and gutka in India, along with cigarettes, are the cheapest and most widely available, while alternatives such as e-cigarettes are banned. So there should be policy investment into these products to understand. And it is not that other countries have not regulated them. Now the entire West has regulated these products. So it is possible to do it. It's just that it requires political will and some sensitivity to how harm reduction can help tobacco users.
Thank you so much, Michael and Samrat, for joining us today and for being completely honest and candid in your responses.
With that, we move on to the final session of this conclave, which is a fireside chat titled Empowering Community Engagement, Need for Governments to Implement Harm Reduction Programs at Scale.
Professor Mishra, if I could pose my first question to you. The various stakeholders in the harm reduction ecosystem, from the consumers, the everyday people, to the policy experts, to the lawmakers, to medical professionals, they have fairly divergent views. So how challenging is it to manage their competing interests? How does one strike the right balance and move forward on harm reduction?
Our constitution of our country is supreme. And our constitution always speaks about freedom and choice. Whenever we make any law, it has to be non-discriminatory. We have to ensure that it doesn't show any biasness. So my take is that when we are talking about policies or laws, we have to make it neutral. We have to make it as per the spirit of our constitution. And we have to ensure that we don't infringe on the rights of the consumers. You see, the Consumer Protection Act of 2019, the modern Consumer Protection Act, as we call it, which the Modi government has brought, is an excellent piece of legislation. It has upheld 6 rights of the consumers in the country, and choice is one of it.
Absolutely. And, Dr. Desai, I'd love for you to react to some of Professor Mishra's comments here. In your personal and professional capacities, how can we course correct in this regard?
In mental health and especially additional substance use treatment and prevention, both, what we have learned in science is pragmatism as compared to idealism.
Right.
And so harm reduction approach is essentially based on pragmatism of science over last 50 years. The two is that here indeed there are two consumers, which one will agree that we need to consider. One is the person with nicotine use. He or she is the user and the consumer. The other consumer who must also have his or her rights is the healthcare provider, like I am. Right. Now, as a healthcare provider, if a product or if a certain strategy that's proven definitely not to be harmful, may be useful for some, maybe not useful for some others, why should I, as a consumer of the market, a healthcare provider, be deprived of offering that to my clients? But let's not talk only about e-cigarettes. All forms of NRT, from gums to pads to what have you. And so from e-cigarettes to NRT to medicinal treatment to behavioral treatment, we would like an entire range to be offered, be made available. Let that collaborative decision-making process between the healthcare provider and the concerned user of tobacco decide.
Excellent. Well, it is always a pleasure to be in conversation with such industry heavyweights. So I thank you for taking the time, and I thank you for adding your unique perspectives. Thank you everyone for tuning in.